hospitalizations relative to Newport is a little bit. Some of the data was updated, some of it wasn't, but I believe that it may have been updated in the last 15 or 20 minutes. I haven't checked, but I believe it will report 38 new cases last week, which is the most number of cases we've had to date in a given week here in Newport since the pandemic started. Week before was 34 cases. Week before that, it was 29. So we're no different than the rest of the state in terms of how things are ticking up, and I suppose in the rest of the nation. The running total is 317 cases to date. Of course, I always contrast that with the 02840 zip code that RIDO also reports on. They're reporting 293 cases as a running total. 02841, 16 cases for 309 cases. But I guess those numbers, no one's ever been able to collate or explain why there's always a discrepancy, but it doesn't matter. 38 new cases is a lot of cases. Remarkably, we're still at the 3% positivity rate. There's only 10 communities that are at 3% or lower. A couple of them are at 2%, where we were, 2 or 3 weeks ago. We're at 3%. Middletown's at 3%. Portsmouth's at 3%. Contrast that with Central Falls, for example, 24%. Pawtucket, 15%. Providence, 15%. Central Falls, by the way, has a population of 19,382 individuals. I don't have, the governor pushed off her weekly press conference till tomorrow. As a consequence, our inside information with the Rhode Island League in Cities and Towns, which usually is before the governor's press conference, gives us a lead up to information that's going to come out at the presser usually, as well as the debriefing by the governor's office after, usually at 2:30 or so. Both those events have been postponed until tomorrow, just to see what the governor is going to come out with. I don't have any inside information as to what the governor is going to say tomorrow at her press conference. I'll probably have something at it by 11:30 tomorrow, and I'll try to shoot out an email to all of you if there's anything special that you should know. And I realize that the business community is concerned about moving backwards on things, and I can appreciate where they're coming from, but we're holding our own at 3%, but 38 new cases are not good. All I can say is, as a wrap up, is people are wearing their masks in Newport. Just continue doing it, continue washing your hands, and continue social distancing, and just be careful on Thanksgiving. And we'll get, maybe I suppose we'll still have this briefing next Wednesday. I'm more than happy to do it the day before Thanksgiving, but we're in like the rest of the country, we're in some serious times, and if I could put my finger on something, I would, but I can't put my finger on as to what's going on. I would note that Salve, and this is just for information. It's not to point any fingers, but Salve did have, in the last 7 days, on their dashboard, had 14 new cases, or 14 cases that tested positive in the last 7 days. So the virus is certainly ensconced in our community. So I just suggest everyone be very, very careful if you can. Just heed the Rhode Island Department of Health's whatever advice they come out with, and we'll come out at the end of this, fairly soon, but just need to be careful.
Joe,
that's all I have, Madam Chair.
Could you give us an update on the testing sites in Newport? Is there anything going on at Stop and Shop? I heard that there was something.
I don't have any special information on that, Lynn. If someone's feeling sick, call your doctor. Do like I did. I called my doctor, but I had some issues with that. So I started fishing around on the RIDA website as to where I could get tested, and you all know where I ended up getting tested at out of Newport.
But Lynn, they are doing testing at the Stop and Shop, in the Stop and Shop parking lot at the Rotary.
Right.
Right.
But it's asymptomatic only. I did get asymptomatic testing there. It was drive-through testing, so it was pretty easy. They have walk-up as well at the same location.
Okay. Right. And then,
So, yeah.
it's
Hold on, Susan. I'm gonna let Lynn finish, and then everyone has their hands up.
Yeah, I'm sorry. I didn't realize everybody was here. Sorry, I just have a couple of pictures on my screen. Yeah, it just seems as though it's sporadic and it changes often. So I just was wondering about that. Thank you.
It has. I think what may help is I had intended to, but I obviously didn't do it, is pull together a one-pager on debating on what the testing circumstances are here on the island. I know it's changed in the last week.
And the portal.ri.gov, that just got stood up last week, and I got my results through that, and that is a much better system than the ones that we had before, where you kind of had to like go to maybe, if depending on where you got tested, you might have to go to a different lab website, and now it's just all on the one website. So I think they are getting a little bit better, but yeah. Councilor McCalla.
Thanks. I just wanted to share that I actually happened to touch base with a couple of representatives from the EBCAP's Family Health Center, and they had actually reported that, so I guess like the good news is a lot of people are they're seeing a lot more preventative appointments happening, but in the sense where people are getting pre-tested because they are still planning on going out of state to go see families for Thanksgiving. And I'm wondering if Newport Hospital is seeing kind of like the same trend, and what would be our plan for that? Is really what I'm thinking. Do we have a plan in place, like in regards to people are going to be coming back from vacations despite the governor's, recommendation against, thinking outside the box and making sure that we're not even gathering with family members that may not necessarily be the case. And then the other thing that I think about, Joe, I have been thinking about, kind of your experience in regards to, although it may not have served as a barrier for you to go to Warwick in order to be able to get testing, I think about some of the rest of the community too that rely on public, transportation and may not have the same access for transportation or resources in general to be able to get there. And what's our plan?
Well, we don't control the public health. I know time is short. I could go on about 2 hours about the public health system and the adequacy of testing. But if you're talking about a segment of the community that lacks transportation, I believe that EBCAP is the right outreach mechanism. They have testing facilities. They have test. They're trained in it. They're right to, they're easily accessible. There's that aspect of it. Then there's the asymptomatic aspect of it. So when you say, what's our plan? We don't have a plan because we don't control the circumstances here. We can only make suggestions. There's an overarching issue here that is, and there's no point in getting into it now. The testing facilities are coordinated with Rhode Island Department of Health in the state of Rhode Island. And when the book comes out after this, all this is over, we can all comment on the adequacy of the system. But right now, EBCAP is a site. You heard Stop and Shop is a site. The RIDO, going on the RIDO website explains where all the respiratory clinics are and where all the asymptomatic places are that you can get tested. That's the plan. That's the plan that RIDO has. You feel sick, Call your doctor. That's the first thing they say. If you don't have one, try one of the respiratory clinics and try one that's close to you that you can access the testing. I went out of town because I wanted to get the quickest possible result. And let me just say one other thing, is the experiences that we're having here locally are no different than the experiences that are going on in Massachusetts in terms of testing adequacy and time lags between the time you take the test and the time you get the results.
And I'd also like to highlight in regards to Stop and Shop, I believe it's only asymptomatic testing can be completed there, correct?
Correct. That's correct. So you have to, so if you're symptomatic, you call your doctor or call a respiratory clinic. And that's the urgent care.
Just a follow-up question though on Councilor McAllis. You had mentioned that you or someone on staff was looking at putting together that list of all the different testing locations on the island. Is that something that either you guys are putting together or someone at Rido maybe already has, so that we can do our part to?
I'm just going to condense it off of the website, the Rido website. You go on the Rido website. Right.
That way we can more easily publicize it though for locals.
Right. I'm going to do it.
Yeah.
I
Councilor McLaughlin.
So,
Oh, Angela, finish up.
thank you.
No, it's fine. I think I have a little bit of a delay, Angela, so excuse me if I don't catch you.
Oh, okay. All right. No worries. Yeah, I just want to say, I think that we should be thinking about the precaution as the holidays are coming. I suspect that there are still going to be people that are traveling out of state. And when they come back, how will we deal with that? That includes the testing, the wraparound, and the access alone to be able to get the testing and, much needed information, the results for that. I really think, yes, I understand that it's, that the state is controlling much of this, but I also think we have to be at the forefront to be saying as well, don't forget about Newport as well. And we're seeing, EdCap's seeing this surge, and I want you to be aware of it. And I want us, I think we should have a plan. That's all I'm saying.
Councilor McLaughlin.
Joe, are the survey numbers included in Newport's numbers?
Yes.
Okay.
So I don't know how when they say the last 7 days, Justin.
Councilor Taylor.
I don't know how it correlates with the 7-day cycle of how Rido was reporting their numbers, but the answer is yes.
Okay.
That was a big issue early on with all the municipalities that had universities as to whether those types of numbers were included in the local numbers. The answer is yes.
I just wanted to oh, sorry. I don't know when we're going to get cut off here. I was contact traced with a phone call about noon on Thursday last week, and I immediately went to try to get a test scheduled. It's negative, by the way, but I called up my primary care physician, and I was on hold for an hour and 10 minutes before I got to speak to the COVID triage nurse. During that time, I went to the Rido website to see what I could get. And I've heard more than one person say that Stop and Shop is asymptomatic only. I'm not convinced of that. I actually, at that time, I've been having terrible hay fever this past week. I've been doing the fall cleanup in the garden with the beautiful weather. And, I'm sure a bunch of that stuff has gotten into my nasal passages and my throat. And so I did say that I'd had congestion. I'd had, I think I said everything but shortness of breath. I'd had a cough. I'd had a sore throat. I listed all of those symptoms. So I did get an offer of an appointment at Stop and Shop. as it turned out, that appointment was earlier than the one that my primary care physician ended up offering me. So I went to Stop and Shop and excited about the governor's new portal with results. I was checking that regularly, but the results actually came through faster by checking the website that I was given when I drove through the testing site at Stop and Shop. It was smooth, easy, painless. I was frustrated that it took 48 hours to get tested. It took 3 more days to get the results, but 5 days after getting the contact tracing call, I got the results. I also am going to be very interested to hear, I don't know if there's time on this call, to hear from Charlie Holder about the experience in the restaurant community with testing and where restaurant workers are going when they're asymptomatic and how long it takes them to get results back.
We probably have 5 minutes. Charlie, I don't know how much you can get into it in that time. And
well, the restaurant employees, they're in the same boat. You know, they're told to go to the portal website and get on that way as well. But I've had a couple of my employees personally that were able to get tested pretty quickly. Some that live out of town, you know, they go, you know, Narragansett, you know, West Warwick, you know, they're able to get some tests up that way, and they get the results back pretty quick. So
what does
they're in the
quick
same
mean?
boat.
What's pretty quick?
2 to 3 days. And I've been to Stop and Shop 2 times myself in the past month, and I've gotten my results within 24 hours.
Wow.
Both times.
Yeah, I had to go as well, and I got mine 24 hours.
That's pretty good.
Yeah.
But you know what? That's the tough part with this is I've gotten some anecdotal stories from folks on both ends of the spectrum in terms of ease and timing. So it's hard to. I almost, you know, it almost feels like it depends on. Sometimes you get lucky and sometimes you don't.
I think the situation is fluid, and while I think a sheet with instructions for people on the island is a good idea, I think that it needs, you know, the information needs to be checked regularly if we're publishing it because the situation is fluid.
Yeah.
It's also the lab.
One more thing I want to bring up, Joe, is I saw that the Regional Coalition of the Northeast Governors announced that they're encouraging their colleges to provide testing to all the students before they leave for Thanksgiving break. And I know that I didn't see, well, I did see that Rhode Island is on there, so I didn't know if we had any good status with, if we had any conversations with Salve about what they're doing and how they're providing testing.
Well, anecdotally, what I know is they have been very aggressive with their testing, and I think it's reflective in their numbers. But I mean, I can't tell you. We do have regular conversations with them and regular monitoring. They have a good reporting site as to the number of cases and how many cases have been, you know, what the number of tests. If you look at the number of tests generally in Newport, you know, I think there was 1,500 or 1,100 tests last week. I think that's mostly attributable to Salve being aggressive with their testing. So that's the only information I have on that.
Just a comment on that. I think Salve is offering tests for students who are going home. That's true.
Yeah.
Okay, that's good to hear. So is there, I mean, I want to open it up to anything else too, because we have about 9 minutes till we're due to start with National Grid.
How is Joe doing?
You know, I'm doing pretty well. I have some lingering stuff, but it's nothing nothing monumental. I can see where people look at what they say about, some of the stuff sticking around. I'm a little tired, but other than that, I'm fine.
Joe, have you heard from the governor's office if they're going to look at increasing the frequency of either the meetings with the municipalities or the press briefings like she had done earlier in the pandemic?
No, right now we're still on the weekly schedule. Everyone was surprised when we pushed that depressor off to Thursday, which, skewed the whole, skewed all our weekly meetings. But I've had a couple of other meetings with that weren't scheduled with the league on other issues. So, but nothing in terms of the pandemic, increasing those. I don't expect that to happen, but it may.
Yeah.
Do we have
I
somebody
think
that's in touch with the governor's office about when she is talking about the broad, just the rules and regulations that she puts down? Obviously Newport is a little bit lower than most places in the state, especially, Providence, Central Falls, Pawtucket, et cetera.
Well, the answer is yes.
So
I'm on the
Charlie,
phone.
yeah.
And the answer is yes. We have a weekly phone call with them, and then we have a lot of one-offs with their staff constantly over our own specific circumstances, and as do all the communities. And the thing that has struck me in the last couple of days, and in a way it's good, but I think it's a day late and $1 short. I wish it had been exercised, the attitude had been exercised earlier, and that is places that have the high positivity rates, like the Central Falls and Providence, their governance is taking restrictions a bit further, in almost the inertia isolating the rest of us out to look at where we are from our own statistical basis. It's almost the New Rochelle approach that was used at the beginning of the pandemic when they locked down New Rochelle. So, but we do have a discussion with the governor's office on every little tidbit that's related to the pandemic. There was a time there in which it was a 7-day-a-week conversation, for that matter. But now we have these two group conversations on Wednesday, one at 11:30 and one at 2:30. And then we have all our one-offs that are specific to our communities with issues that are specifically related to our community. And I'm the guy on the phone.
And the League of Cities and Towns is one of those phone calls that Joe was referencing, and they do a really good job of kind of intaking all the concerns from, they do a really good job of intaking all the concerns from the various municipalities and, being a really good bridge between all the cities and towns and the governor's office. And, Brian and his team will always, I don't know if he has never not answered a phone call from anyone.
Right, and I would say I'll give credit to the governor's office too. They've been anytime we've had a little issue or a major issue, 7 days a week, they'll get back to us. We had an issue with testing one of our poll workers a few weeks ago during the early voting. We had to get someone tested, and I got on the phone and made those arrangements, and that was on a late Saturday afternoon, and we were able to square things away for a test on a Sunday morning. But they've been and I prompted the phone call, but they called me back, and they're very accessible and very responsive. As is I'll just want to echo what Jamie said about the Rhode Island League of Cities and Towns under the leadership of the Executive Director, Brian Daniels. Been fabulous. Brian has done a fantastic job on all fronts.
Yeah.
That's good to know.
Yes.
All right. I see that Jacques has joined. I know we're waiting on Brian, and we do have to wait until right at 5 to transition into the grid conversation.
Madam Chair.
Madam Clerk?
Yes, I'm gonna, I have two separate live streams going, so I'm gonna end the first one if you're all set.
Okay, yes.
Zoom isn't
So
gonna-
do we have to do any?
No, you don't.
Okay,
Just stay right where you are. Thanks.
okay. Perfect.
Jacques, is Brian joining us?
Yeah, I'm gonna text him right now just to make sure he's all set.
Okay, thanks.